Welcome to the Pharmaste's Top 300 Drug Recognition Series. In this explainer, we will review each medication by its generic name, brand name, class or mechanism, major indication, and controlled substance schedule when applicable. Relax your shoulders and take one slow breath. Focus on one medication at a time.
Our first medication is the generic Apixaban, known by the brand name Eliquis. Its class or mechanism is a direct factor Xa inhibitor. The major indications for Apixaban include stroke and systemic embolism risk reduction in non-valvular atrial fibrillation, as well as DVT and PE treatment and prevention.
Next, we have the generic rivaroxaban, which you'll often see under the brand name Xarelto. Just like our first medication, its class is a direct factor Xa inhibitor. Its major indications are stroke and systemic embolism risk reduction in non-valvular atrial fibrillation, DVT and PE treatment and prevention, and cardiovascular risk reduction in CAD or PAD. Let's pause for a quick recall break to test your memory. What is the brand name of Apixaban? It's Eliquis. And which mechanism is shared by both Apixaban and rivaroxaban? They are both direct factor Xa inhibitors. Moving forward, let's look at the generic dabigatran. Its brand name is Pradaxa. For its class, it's a direct thrombin or factor IIa inhibitor. The major indications remain stroke and systemic embolism risk reduction in non-valvular atrial fibrillation, along with DVT and PE treatment and prevention. Our next generic medication is edoxaban, sold under the brand name Savasa. This brings us back to the direct factor Xa inhibitor class. The major indications for edoxaban are stroke and systemic embolism risk reduction in non-valvular atrial fibrillation, as well as DVT and PE treatment. Time for our second recall break. Which generic drug is sold as Pradaxa?
The answer is dabigatran. Next, which drug directly inhibits thrombin rather than factor Xa? That would also be dabigatran.
Let's shift to a very common generic, heparin. It is sold simply as generic heparin by multiple manufacturers. Its mechanism is an unfractionated heparin. It potentiates antithrombin to inhibit thrombin and factor Xa. The major indications include the prevention and treatment of venous thromboembolism and providing anticoagulation during selected clinical procedures. Next is the generic enoxaparin, widely known by the brand name Lovenox. For its class, it is a low molecular weight heparin that potentiates antithrombin, primarily inhibiting factor Xa. Its major indications are DVT and PE prevention and treatment, as well as acute coronary syndromes. Let's test your recall again. Which drug is classified as an unfractionated heparin? That is simply heparin. And what is the brand name of enoxaparin? It is Lovenox. Now we'll review the generic fondaparinux, known by the brand name Arixtra. This drug's mechanism is a synthetic pentasaccharide, an antithrombin-mediated selective factor Xa inhibitor. Its major indications are DVT prevention after selected surgeries and DVT and PE treatment. Our final medication card is for the generic Warfarin. A common brand name is Jantivin. Its mechanism is unique here. It's a vitamin K antagonist that inhibits VKORC1 and reduces the synthesis of vitamin K-dependent clotting factors. Its major indications are VTE prevention and treatment, and the prevention of thromboembolism and atrial fibrillation and cardiac valve replacement. Let's take our final short recall break. Which generic drug is sold as Arixtra? It's fondaparinux. And which anticoagulant operates as a vitamin K antagonist? That is Warfarin. We will now begin the Mixed Recognition Challenge. I'll read each question slowly, so take a brief moment to lock in your answer before we check the key at the end. Question 1. What is the brand name of Apixaban? Question 2. Which generic drug is sold as Xarelto? Question 3. Which anticoagulant is a direct thrombin inhibitor? Question 4. Which 3 oral drugs are direct factor Xa inhibitors? Question 5. Which drug is an unfractionated heparin? And question 6. Which generic drug is sold as Lovenox? Continuing the challenge, question 7. Which generic drug is sold as Arixtra? Question 8. Which anticoagulant is a vitamin K antagonist? Question 9. Which drug from today's explainer also has major indications in CAD and PAD? Question 10. Which low molecular weight heparin is also used in acute coronary syndromes? Question 11, which anticoagulant is used during selected procedures in extracorporeal circulation? And finally, question 12, which drug is used to prevent thromboembolism in patients with cardiac valve replacement? Now, let's review the answer key to see how you did on the first 6 questions. For number 1, the brand name is Eliquis. Number 2 is rivaroxaban. For number 3, the direct thrombin inhibitor is dabigatran. Number 4 asks for 3 drugs. They are Apixaban, rivaroxaban, and edoxaban. Number 5 is heparin, and for number 6, the generic for Lovenox is enoxaparin. Let's check the final 6 questions. For number 7, the generic for Arixtra is fondaparinux. Number 8, the vitamin K antagonist is Warfarin. For number 9, the drug with indications in CAD and PAD is rivaroxaban. Number 10 is enoxaparin. Number 11 is heparin. And finally, number 12 is warfarin. Review these medications again tomorrow and once more in 3 days. Try to recall the brand, class, indication, and schedule before checking the answer. Take one slow breath and recognize the progress you made today. We lift as we climb, one medication at a time. As you step back into your practice, ask yourself, how quickly will you recognize these critical differences the next time you review a patient's chart?